Today we'll be talking about the ultrasound examination of the heart, vessels, and abdominal organs. Today, mainly we will be discussing three parts of each examination, indications of what it detects and how the doctors will carry it out. For indications, for patients with chest pain, shortness of breath, hypotension, penetrating trauma or significant blunt trauma, or cardiac arrest. For chest pain, is for patients with left ventricular wall motion abnormalities or right ventricular dilation or visualization of an intimal flap in the ascending aorta. For shortness of breath, it includes a pericardial effusion, which explains undifferentiated dyspnea in up to 13% of cases, acute coronary syndrome, pulmonary embolism, endocarditis, and valvular heart diseases. For hypertension, it includes massive or submassive pulmonary embolism, cardiogenic shock, pericardial effusion with tamponade physiology, aortic dissection, or hyperdynamic squeeze, which may suggest sepsis or hemorrhagic shock. For penetrating trauma or significant blunt trauma to the chest, it includes pericardial effusion with or without tamponade physiology. What it detects? It is used in diagnosis and management of imminently life-threatening diseases, which includes pericardial tamponade, acute coronary syndrome, cardiomyopathy, pulmonary embolism, and Stanford type A aortic dissection. Cardiac ultrasound can also help to differentiate shock states and guide resuscitative measures. Next, how does doctor carry it out? The operator or the doctor stands at the patient's anatomic left. The indicator on the probe is directed either on the patient's anatomic left or right depending on the view, and the screen is on the right side. A low-frequency phase array probe is best for cardiac ultrasound. Mainly, there are four key views: subxiphoid, parasternal long axis, parasternal short axis, and the apical four-chamber. And as usual, for preparation, patients should be lying supine on the stretcher with the head off the bed approximately 30 degrees upright. For males, the chest should be completely exposed, and for female, the hospital gown can be gathered at the level of breast and towels tucked around the gown edges to keep it dry from ultrasound gel. Alternatively, a towel can be draped over this area if the patient is not wearing a gown. Next, the ultrasound examination of vessels. What are the indications? Blood clots, poorly functioning valves in the leg veins, which can cause in the leg veins, which can cause blood or other fluids to pool in your legs, or venous insufficiency. Heart valve defects and congenital heart diseases. A blocked artery, arterial occlusion, decreased blood circulation in your legs, peripheral artery diseases, bulging arteries, narrowing of an artery such as in the neck. Basically, vascular ultrasound uses sound wave to evaluate the body's circulatory system and help identify blockages in the arteries and veins and detect blood clots. A Doppler ultrasound study is a technique that evaluates blood flow through the blood vessels, and it's usually used part of this examination. The ultrasound does not use ionizing radiation, so it's not harmful, and it provides images of soft tissue that doesn't show up on X-ray images. What it detects: it helps monitor and blood flow to organs and tissues throughout the body. It locates and identifies blockages, stenosis, and abnormalities. It's used also to detect blood clots, thrombosis, deep vein thrombosis in the major veins of legs or arms. It determines whether a patient is a good candidate for procedures such as angioplasty, and evaluate the success of procedures that graft or bypass blood vessels, determine if there is an enlarged artery or aneurysm. It's also used to evaluate varicose veins. Sometimes in children, ultrasound it can be also used to aid in the placement of needle or catheter into a vein or arteries to help avoid complications such as bleeding, nerve injury, or pseudoaneurysm. It is also used to evaluate a connection between the artery and the vein, which can be seen in congenital vascular malformations. How does doctors carry this out? In an ultrasound exam, a transducer both sends the sound wave and record the echoing wave. When the transducer is pressed against the skin, it sends small impulses of, this is a transducer, of inaudible, high-frequency sound wave into the body. So, the technologies apply, or the doctor applies a small amount of gel to the area under examination and places the transducer there. And the gel will allow the sound wave to travel back and forth between the transducer and the area under the examination. The ultrasound image is immediately visible on a video display screen that looks like a computer monitor. The computer creates the image based on the loudness, which is amplitude, the pitch, which is frequency, and the time it takes for the ultrasound signal to return to the transducer. It also takes into account what type of body structure or tissue the sound is traveling through. So Doppler ultrasound is a special ultrasound technique which measures the direction and speeds of blood cells as they move through the vessels. A movement of blood cells causes a change in pitch of reflected sound wave, and this is called the Doppler effect. The computer collects and processes the sound, creating graphs or color pictures that represent the flow of blood through the blood vessels. Ultrasound examination of the abdominal organs. The indications are abdominal aortic aneurysm, abscess, appendicitis, cholecystitis, gallstone, hydronephrosis, kidney stones, pancreatitis, inflammation in the pancreas. What does it detect? The abdominal ultrasound imaging is performed to evaluate the kidneys, liver, gallbladder, bile ducts, pancreas, spleen, abdominal aorta, and other blood vessels of the abdomen. The ultrasound is used to help diagnose a variety of conditions such as abdominal pain or distension, enlargement, abnormal liver function, or enlarged abdominal organ. How does the doctor carry it out? The ultrasound scanner consists of a computer console, a video display screen, and an attached transducer. This is a transducer. A transducer is a small handheld device that resembles a microphone. Some exams may use different transducers with different capabilities during a single exam. The transducer sends out an inaudible, high-frequency sound waves into the body and then listens for the returning echoes. The principles are similar to sonar used by boats and submarines. So, the technologist applies a small amount of gel to the area under the examination and places the transducer there. The gel will allow the sound wave to travel back and forth between the transducer and the area under the examination. The ultrasound image is immediately visible again on a video display screen that looks like a computer monitor, and the computer will create the image based on the loudness, amplitude, pitch, frequency, and the time it takes for the ultrasound signal to return to the transducer. It takes into account, once again, what type of body structure or tissue the sound is traveling through.